Hey everyone, it's Simi Shah, and welcome to Trailblazers. Through this series, we bring you trailblazing by South Asians and for South Asians. We're the torchbearers, sharing the stories of the leaders and innovators lighting the way across the South Asian diaspora. Welcome everyone to Season 2, Episode 2. I'm so excited today to welcome Hitha Palepu. Hitha is the definition of a multi-hyphenate. She's an entrepreneur, an investor, writer, and speaker. With a background in pharma, she currently serves as CEO of Rhoshan Pharmaceuticals. Rho Pharma is an early-stage life sciences company with one program in clinical development. With enhanced versions of existing drugs, they aim to provide essential early treatment to the acute leading causes of death, starting with their first product, Rho 11. Of course, she also doubles as a startup investor and advisor, having invested primarily in female-founded companies, including MM.LaFleur, Brightland, and The Juggernaut. What's more, Hitha's longtime blog, Hitha On The Go, has gained an enormous following and paved the path for her book, How to Pack, Travel Smart for Any Trip. She has another book on the way and regularly publishes 5 Smart Reads, a weekday newsletter. She's also a fellow podcaster as the host of One Smart Thing. A paradigm of ambition, success, and candor, Hitha is a trailblazer to a T, and I'm so excited to welcome her today.
Thank you so much for having me.
So I want to start with the fact that any place I look on the internet, you are described as a consummate multi-hyphenate, and I just have to ask, what does a day in the life of Hitha actually look like?
No day is the same. It's chaos, and it's as multi-hyphenated as my job description. And I started calling myself a multi-hyphenate because I'm an entrepreneur and an investor and an author and all these other things. And it takes too long to explain or list them all out. And the days really reflect that. So any given day's got calls with my team or writing or research or back-to-back Zooms for all of my different roles. And it is chaos.
Yeah. Well, it sounds amazing, but it also sounds like a lot of work. So I'm very impressed. I know that you found your beginnings in the world of pharma. Can you speak a little bit to what led you there and what exactly that experience looked like?
Well, the real start was in tech sales with Cisco.
Okay.
So I joined their sales associates program right out of college and ended up on the global pharmaceuticals team after training. And that's where I got exposed to the industry, but realized I actually wanted to be in industry versus being a technology vendor. And at that time, my father's company had started to grow. Up until then, it really was just him and his co-founder. And so good old-fashioned nepotism got my way into pharma. And, for the first year and a half, I didn't know anything. I was Jon Snow. I knew nothing. And I was drinking from the fire hose, learning everything I could. So I actually spent the first 3 months at one of our partner companies that had a more formal corporate environment, learning everything from project management systems to actually the various phases of product development, getting my hands dirty with the actual programs we were co-developing and getting to see what happened when we turned over the project to them and they took care of the rest. And over time, I did everything from program management to technical operations to business development at Cytos. And when we had out-licensed the portfolio as much as we could, I was pretty burnt out because pharmaceutical development is a long game.
Yeah.
And even when your product development is focused on improving products that already exist, it is still an 5 to 8 year development timeline. And I am a millennial, not quite Gen Z, but I needed more quicker gratification than that. So I decided to take a pause from industry. That was also the time I found out I was expecting my first child. And I had a best friend who was like, I'm working on this tech philanthropy platform. Come join me. And I was like, this sounds like fun. Tech. Immediate stuff. So worked on that, wrote my first book, gave birth to my son. I really don't remember 2015 because all of that happened at the same time. And while the book was successful and Rose thriving, that company didn't work out. Ultimately, we didn't have product market fit. Our unit economics were not panning out because the friction of getting people to create donation links and put it in their content seemed a bar a little too high to bear. And as much as we thought the time was right for a platform like that, really now would have been the right time for a platform like that.
Why do you think
But
that is?
I think back in 2015 and really before the 2016 presidential election, philanthropy was still viewed as a nice to have, not need to have. The existential dread that many of us lived with from 2017 to the beginning of 2021. We were a little ahead of our time, I think, but also looking back on it, I think we had a complicated business model. We basically had 3 customers instead of 1, and serving each one of them is challenging. So I'm very grateful for that experience. I learned a ton. I got to spend more time with my best friend than I ever thought I could. Got to get my hands dirty on building something, that was mine. That was not, oh, I work with my father or whatnot. It's made me, I think, a very good investor. For all the reasons Bridge to Act didn't work out, going through them has helped me become a stronger investor because I have a much deeper appreciation of product market fit, unit economics, customer acquisition, and storytelling in a way that had I not had this startup that didn't work out, I don't think I would have actually appreciated or understood the importance of those things other than kind of just being lip service or things you put on a deck, how they really are what drives a company's success. So really glad I went through that, but also it spurred a pretty aggressive investing spree for my husband and I. We established a family office and have invested in about 15 companies to date in the past 5 years. Mostly women founded, women focused, simply because most of the deal flow has come through me. And I'm very lucky to be a part of the New York entrepreneurial investor ecosystem where my friends or their friends or friends of friends know of incredible companies that are starting up and that I feel very gravitated towards, and I'm happy to invest in their success.
Yeah, that's amazing. And there's so much that I want to touch on there, but it's interesting because I just started working at a startup and I originally began in private equity. And I told people, I said, if I ever see myself going back to investing, it would be early stage. And so much of the advice I got from mentors was getting operators experience is the best experience you can have if you ever want to become an investor again, because you learn things like unit economics and what's a viable business model. So that's just really interesting to see played out in real life with people like you. I want to back up a little bit to your experience with pharma because I feel like it's an industry that some people see as fraught with a little bit of taboo. There's a lot of conversations around big pharma. So I'm curious what your approach and thought process around that has been.
Some of it is warranted and some of it is unfairly assumed. So pharma and healthcare is a very complicated industry in that it is multiple industries all in one. You have services with regards to kind of insurance. You have high skilled manufacturing. You have deep research and development and the science involved with it. You have human lives at stake. And the commercialization side of things is fraught with legal and communications and regulatory and all of this. So it is a deeply, deeply complicated industry that is in the business of saving lives, but it is also a private sector business.
Yep.
So I understand why people are pissed that insulin and EpiPens are as expensive as they are. But what people also don't understand is the drug doesn't go from the manufacturer to you, and that there are so many layers of distribution because of the regulatory nature of preserving, having vetted people take possession of the product from when it leaves the manufacturer to before it gets to your house, that also need to make money. Healthcare is one of the largest employers in the United States. And unless we want more jobs leaving our country, prices are going to have to stay at a certain level. Now, all of that to say is there's a lot pharma can do better. I firmly believe that we shouldn't be marketing products to patients directly.
Okay.
I think that is actually very different than how every other established nation operates, where there is no direct to consumer pharmaceutical marketing. The fact that influencer marketing has now been adopted in by pharma companies, I'm like, this is just so weird for me. And no, thank you. But I also think pharma hasn't fundamentally changed how they do business since the eras of the major blockbusters when they were basically minting money and having a lot more successes on drug development. You also have to remember that the products that are getting approved now are third and fourth line therapies. They're not what you're getting immediately now. And pharma doesn't focus on life cycle management in a way a lot of other industries do, which, well, for us has been a blessing because that is been the business model of Cytos and now Rhoshan Pharma, and looking at existing drugs and going, can we deliver them in a different way? Can we improve the product presentation, whether it's reducing the time it takes the hospital pharmacist to prepare the product?
Got it.
So the patient can be administered this product in a fraction of the time, especially in cancer drugs where patients are in the infusion chair for hours. If we can take a product and reduce the infusion time through our new formulation, it improves the economics of the infusion center. So that was our business with Cytos. It's our business with Rhoshan Pharma. And it's a good business to be in, but at the same time, it makes fundraising and that side hard because it becomes the margin story.
Okay.
Like taking existing products that are either genericized or quite affordable, you can't price this at a premium price rate. And so getting physicians love it. Hospital pharmacists love it. The distributors love it. Investors don't love it. And I think that's where we need to see some change from investors of you're still going to make good money off it. It's not going to be the 50 or 100x with high risk at a 10% probability of success, but it's going to be a 2 to 5x with a 98% probability. Investors apparently don't like a sure deal at a small return, which, it is what it is. But that has been my struggle with Rhoshan Pharma is been raising capital. And so my cap table is a lot longer than most early stage or development stage pharmaceutical companies are. I have a lot of individual investors, but I have investors who believe in the product and what our team is doing and are in it for the right reasons because they want to improve outcomes without increasing costs.
Yeah. That's very interesting from a fundraising standpoint. I was looking at the mission and purpose of your company, and I noticed that it's about enhancing existing treatments that act as salves for the leading causes of death in the United States. I'm curious, is what you're doing focused on changing the chemical composition of drugs or delivery, or what's the model here?
We're taking one of the most common oral drugs and delivering it via injection which is done in a hospital setting or an ambulatory setting.
Okay.
So
wow,
that's it. We're taking something that everyone has in their medicine cabinet that works for what you would take it at home. But if you're having a heart attack or a stroke and time is of the essence, having an injectable delivery where it starts working in a minute versus a minimum of 20 minutes, maybe for you, it is an unmet medical need, especially when you consider stroke and heart attack are the third and first leading causes of death in the United States, respectively.
And obviously you mentioned this earlier, but it seems like even the product life cycle for this won't be realized until 2023. How do you deal with kind of that lead time and wait time as a CEO?
I mean, I'm going to be honest, it sucks. And it is a nature of financing. It is also COVID has upended the traditional pharmaceutical life cycle manufacturing supply chain in that we have to put in our orders for vials and stoppers and whatnot even more months in advance than the traditional 8 to 12 weeks in advance we had to before. Because of COVID, we're getting API, active pharmaceutical ingredient, not the tech API, or other raw materials from overseas, we have to account for an even longer lead time to ship it. Half these stuff are shipped on boats, not via air freight. So all this takes a while. And with COVID being COVID, a lot of manufacturers' capacities has been snapped up by COVID specific programs. So it has been really challenging, but I don't think anyone goes into a startup because it's easy
or quick.
or quick. If you're going to be an entrepreneur, it's going to take longer, cost more money, and the problems you foresee are not going to be the problems that are actually going to keep you up at night. But that is why you just need to be resilient. You need to have a strong team. You need to embrace challenges if you're going to be an entrepreneur. And frankly, after this, my last, like this startup and then my previous one, I need a break from operating for a while. I just feel like I am not jumping into my next thing. I don't even know if I want to operate a company after this just because I am so burned out. And it's okay. I don't think we talk enough about that. I think we glorify startup life, entrepreneurial life so much that no one talks about how hard it is and how much it actually can suck most of the time.
Yeah. You know, I'm blanking right now on who it was, but recently there was a founder who was also serving, I believe, as CEO. And he took a step back from his company and published this blog about why he was doing it. And I just remember the whole entrepreneurial community, and I myself thought it was incredibly candid and brought to light the side of entrepreneurship that no one really likes to talk about, because it's not easy being an operator. It's not easy scaling from inception to being a startup to scaling to being a massive company where you're going from that point where you're 2x, 5x, 100x if you're lucky enough. So it makes a ton of sense, and I give you a ton of props for jumping back into it.
I don't think I had an option with Rhoshan Pharma. My dad signed over 50% of the equity to me, and he said it's up to you to decide if this is going to be 50% of something big or 50% of nothing.
I honestly love that. So I am curious about that. I mean, obviously, just being within South Asian families, there is a natural trend of multi-generational businesses and working with families. What has been your experience with that, working with your dad and entering this world?
You know, healthcare, I mean, I don't know anything different, right? So for me, I grew up going to the office with my dad a couple Saturdays a month and watching him set up experiments and do them. And really, my 6-year-old self was far more interested in raiding the supply cabinet and playing on his whiteboard and drawing pictures. But it did plant a seed in that as I got older and was asking him questions about, Daddy, what medicine are you working on? He would tell me, and he would explain it to me in a way a 7-year-old or an 8-year-old or a 12-year-old could understand, that it did kind of nurture this. I would like to do something like this when I grow up. Also, he had a very unique punishment for me whenever I was out of line that I'm going to have to use for my own kids, where if I ever did something that he was displeased by, I got handed the medical dictionary and assigned like 10 words and had to write a report. And then that was a big part of it, because actually it wasn't much of a punishment for me because I found it really interesting.
Wow.
And then I think the other things that happened when I was a child that fostered this, I want to go into healthcare or pharma in some capacity, was my mother's basically surrogate mom here in the United States passed away from breast cancer when I was 6 years old. My dad's best friend, who was like a godfather and just a dear, dear uncle to me, passed away from leukemia when I was 11. And that was at a young age, I was like, cancer really sucks and I want to do something about it. By the time I got to college and started on the chem track, like every good pre-med Indian did, I realized that I was a disaster in the lab. Like, I'm very good at understanding the concepts of science. I am very poor at doing things
the actual science.
Like, I'm very bad at the actual science. And thankfully, found my groove in some political internships as well as some business, sales, and marketing internships. Going to college in Seattle, you have a lot of internship opportunities and businesses at your disposal. And I took full advantage of that. That my dad said, you should not be a hands-on scientist, but you should go into the business of it.
Side.
Like that would be very smart. So my senior year of college, I was applying for a lot of pharma and tech sales jobs. What attracted me to tech sales is pharma sales. If you were a cheerleader with a perky smile, you got hired. The barrier to entry wasn't as high as something I really wanted to go into. Whereas
Interesting.
with Cisco and Microsoft and Google and the sales interviews I was going through there, I was really impressed at the rigor of it, the challenge of learning something new, like learning a tech stack
Absolutely.
and understanding it. And Cisco was a wonderful place to start my career. Truly. I think that sales associates program training is world class and taught me so much, not just about sales, but about effective communication.
Yep.
And introduced me to some of my dearest friends in the world that I'm still extremely close with. And Cisco's a great company. I think they have a great values-driven organization. They really care about their people. And it was a wonderful place to start my career. And then I was also grateful for the opportunity to jump ship when I recognized that my passion was elsewhere.
Yeah. No, that's incredible. One thing that really stands out, I was listening to How I Built This by Guy Raz with Tope Abawana, the founder of Calendly. And it's incredible to me. I mean, he used to go door to door selling alarm systems.
Mm-hmm.
And it's just so clear that having early beginnings in sales can serve you so much throughout the entirety of your career. And it sounds like that's the case for you. But that's really exciting in that you were able to then go and take that knowledge and apply it elsewhere. I'm curious a little bit on the startup side of your life and the investing side of your life. What advice do you have for young South Asians and young professionals who want to get into angel investing?
I mean, my angel investing journey was totally by accident. I was a fan of a brand, basically became friends with the founders as they launched, and we were kind of growing up together. And it was over a conversation about how we both approached negotiation that I even found out they were raising. And I was like, wait, I'll invest. I have some money. I'll invest. And Sarah, the CEO of MM.LaFleur, said, are you an accredited investor? And I was like, hold up. I like Googled it, like looked up what the requirements are. And I was like, oh yeah, we're this. Like we can invest. And that's how it happened. And for a lot of, I would say about 40% of my portfolio are companies that I was a customer or a fan of first, somehow became friends with the founders, and then was often one of the first checks into the company when they raised. The others were founders have other founder friends. And so a lot have come through our current portfolio, or, in New York, there is a really engaged women's entrepreneurial culture here. And I have some incredible friends that I share deal flow with, and they share deal flow with me, and have found some wonderful opportunities through there. And then one, I invested because I really loved the founder on Twitter. I also was a fan, I had seen the value of CBD. We were ready to make an investment into the cannabis space. I thought her approach to building this company was very smart. And when she asked if we'd be interested in investing in her pre-seed, I hadn't even spoken with her, but I said, yep, let's do it.
Wow, that's really exciting. Yeah, I mean, it's something.
She's the exception to that rule. Normally, we have at least a call before.
A little bit more due diligence. Wow.
A little more due diligence, but it was some very.
Wow. And can you speak a little bit to your investment mandate around primarily investing in women?
I mean, as a female founder who gets a lot of no's, so many no's, and I am often pitching to old white men, I think venture capital as a culture is fundamentally broken and is not designed to support women founders or women-focused businesses, which have very different values than your typical VC-funded, fast-growing startup, and require different mentorship as well. So what I say by that is a white man has to really, really, really screw up to face any kind of consequences. Meanwhile, women, when they take VC capital and raise quite a lot of money very quickly, are given no kind of room to fail, especially since women-founded businesses tend to be a little bit more values-driven or values-centered. In choosing to raise a lot of money and scale very quickly, you lose a lot of that, of the values that you founded the business on. And with that, you're set up to fail. And that really bothers me about venture capital culture. And it's a major problem I see. And we saw it happen with Away. We saw it happen with The Wing. We saw it happen with Outdoor Voices. And really, in the meantime, Adam Newman had to screw up how poorly and how badly to face any kind of consequences. And at that, he's still, I think, a near billionaire.
And they're making a movie about him.
What's happening with Robinhood? It's like, are you kidding me? No disrespect. I'm a Substack publisher as well, but I listened to the CEO's interview with Kara Swisher on Sway, and I feel like I could explain the Substack value proposition and benefits better than he did. And I am just like, oh my God, to raise how much? And that's just like he raised after a failed startup. Women are not allowed to fail. Women of color especially are not given the space and the grace to make a mistake and learn from it in a way white men do. And VC is a big cause of this problem we're having. So by investing in women and supporting women, it allows me to make the change I desperately think we need to see in my own little way.
Wow. I can't tell you how exciting that is for me to hear, because it is something I see, and I'm an aspiring founder one day. I don't know what I will found, but that's the goal, and an aspiring investor. And it is tough when you kind of look around the room and you see it largely full of white men. There's a lot of nepotism, but it's really great to see people like you who look like me who are out there changing the game at least a little bit.
Love. I'm trying. I think my next move after we have a successful FDA approval and eventual exit for Rhoshan Pharma is going to be taking on a venture partner role at a fund that shares my values and learning the nuts and bolts of investing in a different way. We're typically in the pre-seed or seed checks.
Yep.
I'd like to see what goes into investing in a Series A or B. I'd like to work with funds and get an understanding of what does it take to run and operate a fund. And my husband and I have very different investment theses at this point. And so for him to be able to focus on what excites him in investing and for me to focus on what excites me, I think we'll always have our family office and make investments together. But I think it's also time that both of us have very different visions of the companies we want to invest in. And it's time we kind of go our separate ways in a little bit in that sense.
What makes your mandate different?
I mean, his is a more, I think, traditional VC mandate. He is sector agnostic, founder agnostic. For me, it's like, would I be a customer of this? Or am I a customer of this? Or am I a fan? His is similar, but we just have very different interests. So for instance, he was the one who brought in an investment opportunity in a audio platform for esports, which I was like, this is basically any Silicon Valley's investors. They'll just throw money at them. Meanwhile, I'm focused on, cannabis companies that are targeted towards women and an accessory company that's got an incredible virtual try-on platform that has also a huge partnership with Nordstrom. And I see an opportunity for them to scale that. Financial services coaching at an accessible price point for people. Those are the kind of companies that I'm focused on because I go, these are either my pain points being solved by these companies, or I get it. I would be a customer. I would be a consumer. It fits my mold. I also am a lot more consumer facing than he is. He's, I think, a little bit more interested in his interest focus like tech and media or B2B and SaaS type platforms.
Very cool. No, that makes a ton of sense. Wanting to invest in something that you would actually use. Very interesting. I mean, now you're sitting in the opposite seat where you've been raising. How is being an investor informed this Series A process for you?
I hate raising money. What's helped me in being an investor is I kind of knew how to set up my diligence room. I knew how to prepare for a Series A diligence process. I had started building relationships years ago that would be appropriate for a Series A raise. In building those relationships, I also knew what investors, funds, or individuals would look for in order to invest. Like, have you filed your investigational new drug application? Do you have human data? Do you have your manufacturer sorted out? Has tech transfer been completed? Where is your patent process at? All of those things, I knew what I had to have completed in order to raise an A on my own terms. I also am dipping back into my Cytos experience and testing the waters of if someone wants to acquire or license the product at this stage, but let our team continue developing it. Because having licensed products and had co-development agreements or licensing agreements go both very well and very poorly, I also know what to look for in the right partner and in the structure of the agreement to see what that looks like. And I'll approach both kind of parallel paths and see how things are going. And it's also important to know that you got to keep updating people as things continue going well all the time. So that is something, conversations I'm continuing to have and whatnot, but it's a lot of work. You have to have a really strong sense of why, and that goes beyond the company.
Okay.
Like, I care about people not dying if they don't have to.
Seems like a fairly good purpose that you've got there.
That's what helps me get through the many no's I get, the passes I get, the discouraging calls from a cardiologist who's like, nah, I don't see it, that I get, because that's going to happen.
Yeah.
So you have to have that strong sense of why and why me and whatnot. So
maintain conviction.
Yeah. But it is incredibly discouraging. You also got to know when. I think we glorify hustle culture far too much. You also need to take care of yourself. I sleep 7 to 8 hours a night. I did dry January, and I think it's going into just stopping drinking, really, because I'm like, I wake up feeling a lot better. I eat a lot more greens and salads now. My Taco Bell addiction has been replaced by...
You're going to have to teach me on that one.
Okay, the sweet green crispy rice bowl is a game changer because it's got the crunchies that you might want in like nachos or a crunchy taco. And you just get a lot of like Mexican-y kind of ingredients.
I can't tell you how much I miss sweet green. I can't put it into words.
Even my dad has become a fan. He's like, oh, this salad is definitely worth $20. I have no problem supporting this company. And I'm like, God damn it. I wish we got the deck for sweet green when they raised your first round. Is it too late to come in?
That's awesome. I want to spend some time on that because another thing that I just feel like you've done such a great job at is being really candid about what your experiences are like. You don't pretend that it's all sunshine and rainbows all the time. I mean, what are your tips and tricks to like do it all?
Well, be a mother, because then you have no time to pretend everything is okay, which is the truest thing. I have been in that position where I tried to just show the best parts of my life, and it was a very airbrushed, perfect-ish thing. And I was hating that kind of content I was creating, and I wasn't getting any kind of engagement or whatnot. It wasn't until I started being real that I started growing from a social following. Like, my newsletter started growing, Instagram started growing. I started getting some great approach for some incredible partnerships. And a big part of the partnerships and the success I've had with them is because I am so honest. Like, the Blue Apron right now, I'm like, I'm not meal planning. Who's meal planning? I'm either eating my children's little spoon plates or I'm making a Blue Apron meal. And thank God they have these wellness options that fuel me with really delicious food. I just started a partnership with Spotify. And it's because Spotify, I talk about how Ro ruined my algorithm. And now the Elena of Avalor soundtrack pops in on my Get Up playlist every single morning.
Oh my gosh.
I've kind of moved to Spotify because I like having my podcast and music in a single app, and I don't like jumping back and forth and whatnot. So it is about, in being real, one, it's easier. And then two, what I learned at Cisco is people buy from people. You ultimately have to be a likable, kind, gracious person in order to build any kind of relationship with your clients. And then you also got to know your stuff and be able to provide value. So if I'm only providing value, but I'm not being real, the story isn't strong. So yeah, motherhood actually was the ultimate hack in just helping me abandon all of my whatever inhibitions or boundaries I had set, because I'm like, I have no time for this.
Wow. Well, I'll put that on the to-do list many years from now.
Yeah, you do not need to be a mom to do this, but just kind of embrace it with, what do I have to lose? I can lose some followers. People see me with no makeup on. Newsflash, who's wearing makeup every day, especially in COVID? So it's all good.
Yeah. Wow. I mean, that's a great philosophy. And I think it's also something we just need more with the birth and rise of influencer culture. I think that's what we need to see is authenticity on these platforms, especially I think for younger generations for whom these social platforms are going to be pretty native to everything that they do and see and watch and participate in. Super interesting. I do want to spend some time on one of your other hyphens, which I can't even believe I'm saying right now, but Hitha On The Go and 5 Smart Reads. I mean, how did you find your way into the media world of newslettering and podcasting?
Oh, wow. How did I end up on the media side of things? So Hitha On The Go started like every other blog in the existence of blogs. I had a very uncreative job and I needed a creative outlet. And if you had told me when I started that blog from some random hotel room in some random city back in 2009 that I would write it for about 10 years and get a book deal and video projects and product partnerships out of it, I would have been like, you're effing crazy. What do you mean? But it did. I got my first book deal for How to Pack, Travel Smart for Any Trip from that blog. It really kept me sane, I think, during building a pharma company the first time, because I had something that was mine. I had something that was my instant gratification type outlet that nourished my creative juices while I was focused on something much bigger and much more technical and much slower and whatnot. So I stopped with the blog at the end of 2018 because I found out I was pregnant with Rocky. Rhoshan Pharma just needed my full undivided attention, and I had to fully focus on that. And that's when I also was moving away from kind of the general lifestyle content. I didn't feel like that platform or that content, I was excited to create it anymore. And I was far more excited to talk about the news because I'm a nerd and that's all like I want to talk about those things. So 5 Smart Reads started kind of as my, okay, well, what's my new creative outlet? And it started on Instagram stories because I needed something that was easy for me to create content on my phone. I didn't have time to take out my camera and take pictures, write the post, hyperlink everything, put together all the SEO keywords and all the social shares. Producing a blog post at the quality I was used to creating it was just too much for me at that time. In a way, Instagram was much more accessible. And by the way, I was sharing 5 Smart Reads to crickets the first 2.5 months, like very little engagement.
That makes me feel better.
Very few swipe ups. It was like, hello, anyone there? And all of a sudden, people did start, I think when the consistency thing matters is people are like, is this for real or is this just something someone's trying out? So doing it for a couple months kind of proved to people, it's like, okay, maybe I'll swipe up and actually see what she's talking about here, that people started getting engaged with it. And it also gave me an opportunity to kind of break down complicated healthcare things in this format because I go, I understand this. I know how the sausage is made. When you hear, oh, insulin costs $5 to make, I go, well, what insulin? There are like 5 different kinds of insulin and they all have different patents. And insulin is a biologic. You have to basically manufacture insulin and then a stabilized version of it that's a pill or an injectable or whatnot. And that is complicated stuff that has patent protections. And then it goes from the manufacturer to the distributor to what's negotiated by the pharmacy benefit manager, but also the group purchasing organization before it hits your Walgreens or your CVS. And so I understand this. And I understand when people are like, insulin prices. I am like, you should be mad at your insurers and CVS too. Don't be mad at Eli Lilly. You could be a little mad at them, but be mad at everybody else. That's what 5 Smart Reads allowed me to do. And I think I was also part of a wave of people wanting something different from Instagram that I happened to be an early adopter in changing and not just doing the pretty perfect pictures on Instagram, but
informational content.
Stories. Yeah, you need to read every day. Here's a picture of me balancing a cupcake on my belly, like no makeup and looking like a hot mess, and microblogging on Instagram. So frankly, that I can't believe has been as successful as it has. And as I'm writing my second book, I actually just do miss being on Instagram and chatting with people, and I enjoy it. And the biggest thing with content that people forget is if you don't enjoy creating the content, people aren't necessarily going to enjoy reading it or consuming it. You really have to do it for you. When it stops being fun, don't be afraid to walk away like I did with the blog, because that gave me the opportunity to create 5 Smart Reads, to create content with great sponsors and partners for Instagram. Thank God Substack came around at that point, because now it's a very convenient way of creating my newsletter in a way that I can offer the paid daily newsletter or the free weekly newsletter. And I was paying $250 a month on ConvertKit to send out my newsletter. And now I'm making
money. Yep.
You know, it is a very valuable platform that came at the time I needed it. So, you know, being open to opportunities, I think, is the biggest thing. Also, know what you're good at. Like, I should not be on TikTok, and I am not on TikTok. I think maybe at some point I'll do like a green screen and be like, I'm going to explain insulin. And I can do things like that.
I'd watch it, and I'm not on TikTok either, but maybe I'd make an account for it.
Clubhouse, I enjoy, but I'm also not the earliest adopters to platforms. What I find is I tend to try out things that I wish platforms had. And sometimes it works out and sometimes it doesn't.
Yeah, that's super interesting. Wow. I can't tell you how much of this resonates in the way that Trailblazers was born, in terms of working in finance and wanting something that nourished my creative spirit, to also just hearing about your journey and knowing that hopefully it's worth it. I mean, I feel it is, because I love what I'm doing. In a world where there's so much information saturation, how do you think about what to curate in 5 Smart Reads?
It has to be something that isn't trending, or it's offering a new perspective from what is trending.
Okay.
So, for instance, and then I also get people who are like, that's wrong, and da-da-da-da-da-da. And I go, I never said that this is a journalistic outsource. I am curating things that piqued my interest and got me thinking about things differently. So I do try to make sure it's got some kind of global balance, although I haven't been doing as good of a job of that. Just recently, I barely know what's happening in the world. I used to be much better about curating one healthcare story a day. I'd like to get back to that once this book is done, and just going deeper into explaining healthcare to people, because especially with COVID, I mean,
it's important.
All of us are pre-existing conditions now. COVID is going to have significant consequences in what is a pre-existing condition and who gets access to care. And also, as we learn what COVID long haul is going to do to the body, we don't know.
Yeah.
I do expect the incidence rate for strokes to increase, given what we've seen with microclots and coagulation in COVID patients, even people who seemingly recover fully. I think you're going to see myocarditis, or a significant weakening of the heart muscle, is something you're seeing in a lot of mild COVID patients who have fully recovered. And so how do we triage cardiac arrests and cardiac events from at home better, in the ambulance better, in the emergency department better? So I can't believe we're living through a massive global pandemic like this, but also, what does this mean for the future of mRNA therapeutics? Can we be more proactive about advancements in vaccine delivery? Can we create ways that we can easily enroll clinical trials? We have greater partnership between industry and the governments. How do we do this globally? How do we take care of the whole planet, not just our own hides? So I think it's going to be really interesting. But I guess it's like, for me, back to the original question of 5 Smart Reads, what do I choose to curate? Does it make me think?
Yeah.
Does it offer a point of view that I might feel uncomfortable reading because it's so not in line with how I view the world? And if it does, and if it shakes me up a bit, then I'm like, you know what, I'm sharing it. Like, for instance, I shared a piece about Mulvaney that a couple of my Russian friends were like, this is fake and false, and this is so wrong. And I said, here's the thing though, as a South Asian and seeing how Western media reports on India, seeing how different Indian outlets report on India within the same country, there is some, I'm not going to say this is a purely factual thing, but this is a perspective we have to consider because
Absolutely.
how things are being reported are not accurate portrayals of how things actually are. And you have to read different points of view in order to understand or get to a sense of what is the actual truth here.
Absolutely. I think that's an awesome perspective to take, especially because I think as there is more content, people become much more selective about what they read and they don't expose themselves to multiple perspectives. And that's why we have so much polarization in this country and why nationalism is on the rise. So I think it's really exciting that you're curating content in that way, because I think people always think about just creating content. They don't think about distribution and curation in that mindset of how the world is evolving. So I'm a big fan. I love it. I'm here for it. Something I want to touch on, because you also just talked about South Asian communities, is, I mean, how has your South Asian identity impacted you through all these careers that you have and hold on a daily basis?
Honestly, and I think we as South Asians need to talk about this more, we very much benefit from brown privilege in this country, in that if you live in an urban area, that has some level of diversity, when people understand that you're Indian, their first misconception about you, or their first bias about you, is that you're smart, that you work really hard, that you're a beast in a professional sense. That's a bias that has only served us.
Yeah.
And that we have benefited from in a way Black, Latinx, Indigenous people have not benefited from at all. And I think it's important to call it out because it is a big part of my success at professional success. I think people assuming I am smart has been a huge boon to my career, both in tech as well as in life sciences. People assuming I work hard just because of the nature of the color of my skin and the origin of my name is something I haven't had to deal with negative bias in a way other people of color have. And I think it's important we acknowledge that. I do think, from the content side of things, for most of my life, really, again, until I had kids and I was like, this is too goddamn exhausting, is keeping my American and my Indian sides very separate. And I think we also grew up that way, where we had like our Indian function parties on the weekends, but on the weekdays we were playing soccer and sports and debate and all these other things at school. And, we were eating sandwiches like everybody else during the day and eating dal and rice and eating with our hands on like metal plates with a large lip every night. And there was very little overlap of my worlds. And I think I also grew up in a time where it's still very much a white dominant culture, American culture is, but it is the opening up to other cultures. What I think is important now that I mostly want to model for my kids is how to be both at the same time. And we are living in an era of multiculturalism in content, in media, in entertainment. It almost gives us permission to do that. And I've been living a little bit more bravely in a more multicultural facet now than I ever have. For my kids too, I also had to sit down and learn about different things within Hinduism, because I know when I asked these questions when I was a kid, my mom would just be very quick to say, well, that's just how it is. And I was never satisfied
with that answer.
And I think it turned me off from that, among a lot of reasons, turned me off from organized religion. But, I also think there is a lot I could still learn. I know nothing. So in not knowing anything, it's an opportunity to learn and educate and inform myself so that when my kids ask me these questions, I can at least offer a response that allows them to make the decision, oh, do I want to learn about this more?
Wow.
Not, oh, mommy just shut me down and I'm just done with this. So, and I'm also very lucky to have built relationships with friends who know a lot more about this than I do. So I'm able to text them and feel like, can you explain fully to me again? Why? I know it's really fun, but why?
Wow, that's incredible. And I also have to say, I mean, I feel like there is really a renaissance with respect to South Asian culture, with content, all these things that are out there more so in mainstream media, and being able to complement that with your home life is really beautiful. So I appreciate you sharing that. Thank you so much for joining me on Trailblazers today, Hitha. You have such an incredible career, and I and young South Asians have so much to learn from you, so I really appreciate you taking the time.
Thank you so much for having me. This was great. And I can't wait. You can slide into my DMs. Like, I might invest in your company, but I'll definitely answer your question.
I love it. Thank you so much, Hitha. This is a podcast from Trailblazers Media. For more content on South Asian trailblazing, follow us at South Asian Trailblazers on Instagram and Facebook.